Hello. Welcome back to Gut Feelings, Life Unfiltered. And today's episode is one that I love. I'm really excited to talk about. We're actually going to go deep into bioidentical hormones. I mean, not like the Instagram version where everyone's talking about it, and not even like the fear-based version, because there's a lot of people that have a lot of fear around hormones because of the things that they've heard. And it's not just like our take on it is kind of it's a lot of like give and take with hormones. Honestly, it's a lot of experience, what works, what doesn't work. And the truth is hormones are powerful messengers. They amplify whatever environment they're placed in. So we have to remember that they are messengers and the environment is critical. So we will get into more of kind of what that means. But so if your body is regulated, you feel supported, and your body feels ready for the addition of the support of the hormones, hormones are an incredible tool. But if your body is stressed, you're inflamed, you feel stuck in this survival state that Mel and I talk about all the time with the nervous system, hormones can be an awful option for you because they're not going to respond like they would in somebody that has a regulated nervous system. So there's a lot of confusion, and a lot of people have opinions because of just the diversity and the difference in everyone's basically terrain, which is the nervous system. Everyone has started hormones at a different time. Everyone has a different stress level. So there is a lot of nuance to hormones. And this is why we're very passionate about this, because they are awesome and amazing, but it depends on a lot of things.
That's what I love this conversation because it's so like we are unfiltered. We're going to flip it on its head and we're going to make sure that we cover all our bases because I think you're right. There are blanket statements out there that like bioidentical hormones are just the God's gift. Like it's going to save you from
Yeah.
yourself. But if you have this like crazy fight or flight, if you're always surviving, it can be so bad. So I love that we're going to talk about all the sides of it. But let's start with what bioidentical hormones are, what they really do. So they are chemically identical to what your body makes. And that's really, really important. But it's only step one, honestly. Your body doesn't just need hormones, it needs functional receptors, it needs a healthy metabolism, it needs proper clearance, and number one, a calm nervous system.
Yeah.
So hormones don't override the stress physiology. They just are going to respond to it.
Yes. So important to know that. So we'll dig in with progesterone because, this is the one that I call the sweet baby angel. And it is a powerful hormone, but it's not simple. Again, this is not a simple thing. So progesterone deserves its like own little statue because there is a lot to it and there's a lot that it's helpful for. And what progesterone actually does is it calms your brain. It also supports GABA signaling, which we have talked about in the past. It improves your sleep depth. So, a lot of women, when we get into perimenopause, progesterone is that first hormone that starts to decline. And you might notice it with not being able to sleep at night. This might be a big indicator for you. But also, your cycle length will change when progesterone also changes. Progesterone also reduces estrogen driven symptoms. So, a lot of times we get estrogen dominance because progesterone is declining in perimenopause. And then I love this about progesterone. It modulates immune response. So, for somebody like me or somebody that has an autoimmune condition, that immune response, we want to be working at its top tier that we can. And then I honestly didn't even know this about progesterone, but it supports myelin and neuroprotection. So, for me, it's like, what? I want to do anything that can support my myelin with MS. So, again, I love progesterone, but there's a lot of nuance to it. So we are going to get into that. But you can think of it as your brain's calming hormone.
Yeah. And so some women don't respond well to progesterone, which is an interesting fact. So, like, all those things can be true for some, but there's also the other side of it, and this is huge and often misunderstood. So, women, when they're taking progesterone, sometimes they may feel more anxious. It might flare up anxiety. It might cause some more depression if you're already prone to depression, and then you are taking it. It might actually kind of send you into a little bit of a spiral. Dizziness, feeling detached from life, irritability, and all, just like you're just like you're not like yourself, like something feels off. And this will lead to progesterone doesn't work for me. But here's what actually is happening most of the time. It's interesting. There's other parts of it. And one of them is that GABA sensitivity and a trauma history. Progesterone metabolites act on GABA receptors. This is crazy. If someone has chronic anxiety, trauma history, nervous system hypervigilance, past benzos use, then suddenly increasing this GABA signaling can feel so destabilizing, not calming. And it's not wrong. It's just like way too fast because it's almost like your body is so used to being this fight or flight, right? And then you're trying to tweak it and change it, and your body's like, "Ho, ho, 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 it's just
Yeah.
this is too fast for me," right?
Yeah, and remember we said hormones are messengers. So it's like that message gets amplified. So if it's in the wrong environment, it's not going to be sending the right message. And I've seen this actually with patients where very, very high anxiety where progesterone, you would be like that it's going to help this woman sleep, it's going to help her anxiety, and it did the opposite. It
Mm.
amplified everything. But she had been through some trauma, she had a recent loss and was suffering with anxiety and insomnia, and it honestly made her symptoms worse because of the environment that we were working with already, where we needed to actually take a step back and really work on the nervous system. So, another part is the cortisol steal and adrenal dysfunction. I know lots of doctors hate that term, cortisol steal, but I'm going to use that because I feel like I can see what's happening in my mind by saying cortisol steal. So, in stressed bodies, when you're stressed out, living in that fight or flight, progesterone is preferentially converted into cortisol. So, that for me, when I was
So
living
interesting.
yeah, when I was living in this chronic fight or flight, I had very, very low progesterone, which led to my estrogen dominance. But what was happening is my body was demanding more cortisol. So it was taking the precursors that could have gone to progesterone and shuttling them into cortisol because this. I need more. I need more. I'm stressed. I'm like how we live our life these
Mm.
days. So instead of feeling calm when we have this cortisol steal, when we add more progesterone, that progesterone goes into more cortisol. These patients, instead of feeling like that calmness that we should, they're feeling wired, they're feeling agitated, they're having worse sleep, increased anxiety, like I had mentioned with the patient that I had, because of the environment where she was living in that fight or flight. And this is why progesterone, without the adrenal support that we're talking about, can backfire for a lot of our patients. And it's not that progesterone is not a good therapy. And it's also not that there's something wrong with you. It's just that we need to take a step back, look at the environment, look at what's going on, and address things in different steps instead of jumping into the ones that we get. Like, I was so excited about hormones where I was like, this is going to help everybody. But again, I was like, until I learned what I did now, we need to start at step zero and address that part first.
That's such an interesting fact, and I wonder there's a lot of programs, like apps and all these things of, like, order your hormones, and you kind of are seen by,
Yes.
like, this pseudo like, this doctor, but is it I don't know. I mean, I have family members, I have people that are like, "Oh, look I just ordered now I'm on
Yep.
progesterone, estrogen, and testosterone." I'm like,
Hmm.
"Okay, yeah, they did a blood test, whatever, I don't know, maybe they did." Actually, I don't even know if they did, but I'm not just like maybe some of these apps and these like programs are great, but if you're just like blanket giving
Yeah.
people all 3 without like really looking at any of this stuff,
Yeah.
it's such a I mean, you could really send somebody into a major spiral. I don't even know. I
A
mean,
hundred
there's
percent.
so many things. So another key factor is dose and timing errors. it's a common mistake. Like, you're starting out way too high
Yeah.
because we think that we're all the same creature.
Or
And
even based off blood work, you're like, oh,
yes.
you're very, very low progesterone. You need 200 milligrams. But again, it's so different how your body is going to respond to that hormone. And
Yeah.
that's what in perimenopause, there is a lot of back and forth with hormones. So for me, it's like you do have to be patient as the patient because of this back and forth where we have to change the dose multiple times because of how your body might respond. Not everybody is different. There's so many factors we have to look at.
Right. And then also taking progesterone in the morning or
Mm-mm.
using continuous dosing when cycling would be better. So these are something, and you might be able to speak to these a little bit more because I don't do that timing kind of component to this. But I guess it's it's context dependent was what we're trying to say. Each person is this individual human being having this experience, and it may, let's just say you start out with a certain dose or a certain time and it's just not working for you. You have to understand that the doctor or whoever you're working with is going to tweak it. If they're a good practitioner, they're going to listen to you and listen to your
Yeah.
cues and what you're experiencing, and they're going to change it and modify it to fit to your needs and not the needs of what everybody else is
hmm
doing.
I think that is the most important because even like Melissa was saying with the dose and the timing, like for women that are new into perimenopause, we're still cycling, but again, progesterone drops pretty quickly initially into perimenopause. And then when we're looking at the stress component, where you might be shuttling a lot of the progesterone into cortisol, we do want to almost mimic like our natural cycle if we are
Mhm.
still cycling. So we do want to take progesterone at certain times in our cycle. So when we ovulate until we bleed is when I recommend a cycling woman take progesterone because that's when our progesterone is naturally supposed to be higher. But if you're someone that's had a hysterectomy or you're deeper into perimenopause or menopause even, the timing, sometimes people will take it more continuous and then take a break for 3 days because you do want to take a break. Those receptors kind of get oversaturated. So even if you're somebody in menopause, you still want to take like a 3-day break every month. But especially for us that are still cycling, I love progesterone, but I take it during my cycle when I'm supposed to have higher levels to mimic what that natural cycle should be like.
That's such great advice to people
Yeah.
to even ask your doctor, like, are we doing this? Is this what the goal is? I hope that people are taking notes and understanding that these things are really important. And it's so important for you to know how these things work in your life because I mean, most of the doctors here in Michigan, like that I've been to, I'm like, okay, listen, I'm in perimenopause. I have all of these perimenopause symptoms and I did my Dutch test, like, "What can we do with that?" And they're like my OBGYN was like, "What's the point?"
I know, and I hear
Uh,
patients say that all the time. They won't even test hormones.
yeah, and so she's like, "And then what?" Like,
Yeah.
"So now you know, and we're not gonna do anything about it."
Yes.
And it's so
You're
and
right. You're right.
this is a woman, another
Yes.
woman, and she's actually postmenopausal and or like like in her menopausal years, and it's like, how can you just so you're literally that was it. And then I'm like,
Exactly.
"Okay, cool." Like, I'm still not sleeping. My brain is I'm totally wired, like all of these symptoms. And it's just so interesting. Like, at least I know that they can't have every solution. And maybe they can even say that, like, I wish I knew more or like
Mhm.
be humble in that experience. Like, I wish I could help you, but I just don't know what I can do for you. But here are the resources.
Yeah.
Or
And
here is somebody who could.
absolutely. And it's not just in Michigan because I've had patients tell me that in Florida where their doctors won't test because they said the exact same thing. There's no point because I'm not going to do anything about it. Even like
Exactly.
it's like that's horrible.
I know. Like, I get sure, like, why charge you? Why pay for it? Like, why go through it if we're not gonna do anything? But then, like, then give me a resource
Yeah.
because we know that these people are, like, highly intelligent human beings that, think very objectively and, like, know studies, and they have all the research. Like, my doctor was at U of M. Like, are you fucking kidding me? This is a research
Wow.
hospital. You don't have anything thing to give me. I mean, it makes me so angry.
So
And that was
crazy.
like, oh, that was a while ago, and now I know, yeah, there's really nothing that she could have done, but
Ugh.
yeah, I'm sure that most of you out there is like the same thing. And then can you imagine like when our mothers were going through this, they were just like, well, it causes cancer.
Yeah, yeah.
So it's
Let
like
just suffer
just
through.
suffer through it. So at
But
least we are like at least the women of our generation, we just don't put up with shit like this anymore. We're like, fine,
yeah,
we'll just find a new doctor. Or we'll just like find we're gonna do
yeah. We're
figure something.
very resourceful,
We
ladies.
are
I
very
love it.
resourceful.
So we'll talk about the last reason why somebody might not do well with progesterone is if your estrogen is too low. So progesterone needs estrogen to feel balanced. If estrogen is already low, progesterone can feel sedating. It can feel like flatten your mood, even reduce your motivation. So this is why blindly adding progesterone without assessing estrogen status is definitely a mistake. Like I know lots of doctors say, "What's the point in testing?" But there is so much. Like I have to test. Like I have to know what your hormones are doing. And yes, they do change widely in perimenopause, but I need to know a baseline, or I need to see what at least we're working with. Like you
Yeah.
can't just add hormones when you have no idea what's happening.
Yeah, and if they don't believe in the Dutch test, which some don't, which is the metabolites, right, of the hormones. So like some people don't know how like some people, I mean like, OBGYNs, the
Yeah.
medical model, whatever. If they're going to do a blood test, they can do multiple blood tests during
Yeah.
your cycle.
You
So
can
then they
or a
can
saliva test even.
sure. Is that part of you believe that the OBGYNs and like
Oh,
the
I don't know if OBGYNs do
yeah,
that.
they're
Yeah,
gonna
no.
they go to blood.
Yeah,
That's
they
what
do.
they like. And
They do.
so then do it multiple times in your cycle to see where the variation is.
Yeah.
You don't and don't I mean, doing it once is probably a disservice to you anyways, I believe. I don't know what is your take on that. It's
Yeah,
just
I
like
mean,
a
because it
snapshot.
widely changes, but even there's,
Yeah,
like, cool stuff out there, which I tried was, the urine test that you can do at home,
yeah.
where you can test yourself throughout your whole entire cycle and see what your hormones are doing,
Wow.
which is so fascinating.
Does it have like a graph? Like, does it
It
show you?
does.
Oh my
Yes. Yeah, it's
god.
super
Tell
cool.
me later about that. I didn't know you did that.
I did. Yeah, because I was taking a lot of progesterone. I thought all my symptoms were from low progesterone. So I was taking too much and I was taking it for too long throughout my cycle. And I got to understand that was not a good thing for me by testing my urine every single day through my cycle and watching the
Oh.
spikes, lady. I will tell you, like, if you want to be floored with what your hormones are doing throughout your cycle, do this test because it is fascinating. Like, why is my estrogen so high when it's supposed to be low? Like, it's just all over the place. I'll tell you what.
Very interesting. And if you can look at yourself as like a science experiment,
Yes.
that's what we've been doing.
Yeah. It can be fun.
It can be fun, and then you can kind of, like, look at it not from, like, this, injured, victim standpoint.
Yeah.
Look at it from a point of, like, I'm assessing what's going on in my body. My body is a beautiful thing that is healing constantly and doing what it needs to do at this point. And then just, like, yeah, just go
How
through
can I
life.
best support it? Like,
How can I best
and
support.
this stuff gives you information because even
Yeah.
especially this one that you're doing throughout the whole month, you can see how what you're taking will impact your hormones and we work in rhythms and our hormones are up and down and it's a beautiful cascade of like through our circadian rhythm, our cortisol rhythm, our hormone rhythm. Like we want to support the rhythms. So being able to get that picture throughout the whole month and then adding in supplements where it's too low or you're just able to tweak things so much better.
Yeah, I love that. All right.
Yeah.
So the key clinical takeaways of progesterone intolerance, it usually means that the nervous system it has instability. So also your cortisol is completely dysregulated, which we talked about. Maybe there's a poor timing issue or a
Yeah.
dosing issue with your progesterone. And then you also the imbalance with estrogen. So those are the key things that we just discussed. So it's not that progesterone is bad. It's just that maybe these points are something that you're currently going through or experiencing, and you need to examine them. Like we said, you're a
Yeah.
science experiment.
There we go. Okay, next big one is estrogen.
Ah,
Again, we're going to talk about the timing, the route, and the balance. So, Estrogen is so important. I read this book, I think it was called Estrogen Matters. Like, after I read that, I was like, "Oh my gosh, everybody needs estrogen." It's amazing. It protects our bones, it supports our cardiovascular health, it maintains our brain function. They're doing a lot of research in estrogen and women getting Alzheimer's. It supports our connective tissue and improves insulin sensitivity. So, a lot of us, when we get into late stage perimenopause, we start to lose that insulin sensitivity, and that just feeds into the cycle of everything being off. But I will say, when I talk about protecting the bone strength, it is the best therapy for osteoporosis, osteopenia, fractures, anything like that. When I was reading about this, I was like, there, I will absolutely be taking estrogen when it's time, because it is amazing. Because not only does it strengthen the bone, it makes it more resilient. It makes it more flexible. There is nothing else that can make it more flexible. So, like, when you fall, you want that bone to have a little bit of give so it doesn't break. And
Mhm.
estrogen does that, which is fascinating.
It's so true. And you know, like the new, I just hate this, but the new fad right now is to be like stick thin in your like 20s, 30s, 40s. Though like I look at like I don't watch the Oscars. I don't give a shit, but I see like I like the fashion and I'm
Yeah.
looking at these women and I'm like, I'm only thinking about their bone density.
Oh,
Like, I'm
no.
like, "Oh, I love that dress, that's pretty, but sweet Jesus, that bitch is gonna fall and break a hip at 40." Like, I don't like, I don't please God, eat
Yeah.
something or, like, lift some weights. I mean, they're
Yes.
not lifting heavy, they're not
No.
jumping because they can
No.
barely lift their arms up, and I'm not body shaming, this is not me body shaming, this is me, like, literally being concerned for the future of their bones. It's
Yeah.
just it, like,
It's
um
so important, because low estrogen for prolonged
yes,
periods, which when you don't eat enough, your estrogen can be impacted as well. But that
exactly.
low estrogen is going to cause osteoporosis. It can add to cardiovascular disease, add to cognitive decline, and joint pain and stiffness. So estrogen must be balanced with progesterone, and it has to be metabolized properly and delivered safely. So when Melissa's talking about the Dutch test, we are able to see how you are metabolizing estrogen, which is fascinating and so important to know, because if you're adding estrogen to your system, you want to be making sure you're detoxing it properly. And the Dutch test tells us what pathway you are detoxing that estrogen, which is a great thing to know if you're going to be adding in some replacement, if you're more prone to like a cancer that has run in your family. You do want to see, am I detoxing my estrogen down the cancer pathway or down the healthy pathway
Mhm.
before you add in more estrogen. And that's why we love the Dutch test.
Yeah, and I found out that I detox down the cancer pathway. So I have to be very careful and breast cancer runs in my family. So we're going to look at that from a different perspective than
Because
one.
there's things that you can do to
Yeah.
help support your body detox that estrogen down the healthy pathway. So it's like, that's again a prerequisite. We have all these prerequisites for taking hormones, because we want to make sure you will take the hormone and use it the way you're supposed to, but we want to look at these things first.
Yes. So do you hear the theme here, ladies?
It's not just apples and oranges. There's a
Just
lot
don't
to it.
blindly take hormones.
Yeah.
Okay, so let's talk about why transdermal routes are safer. We generally loves the transdermal routes.
Yes.
So transdermal estrogen, it bypasses it bypasses first pass the liver metabolism. It reduces the clotting risk, which some people are concerned about. And then it produces a steadier hormone level. So it's not going to just flush the system with hormones. And it is more physiologic. So it works with your body, not against your body, or your body can handle it better.
Yeah.
Like you said, it mimics.
Yeah.
And then we have vaginal estrogen, which also is so effective. And then, what we just learned about UTIs
Oh my
and
gosh.
people
Yeah.
taking vaginal estrogen and how, especially elderly people who are prone to UTIs, and it
Yes.
actually caused like cognitive issues and
Hmm.
dementia like symptoms and just a lot of different things, and when they get these chronic UTIs, they can't take these antibiotics, it's not working, and so the vaginal estrogen is actually, like, a really effective route that nobody wants to look at, but
Yeah.
the
And
functional medicine.
interstitial cystitis. Yeah.
Sure. Yeah,
Yeah.
so it's extremely low risk, low systemic risk. It's highly effective for urogenital symptoms like I was talking about, and often really underutilized due to the fear.
Yeah.
There's so much fear around it. This is very different from oral estrogen used in the older studies like the Women's Health Initiative that
Yeah.
where it shit on oral estrogen. And now that study was synthetic hormones as well,
Yeah,
right?
it
So
was synthetic equine estrogen,
it
and it was
wasn't
taken orally. So it was not even bioidentical, not the form
right.
that we use, and it was not taken transdermally. It was taken orally. So, and even then, when you take that aside, there was a lot of false information in this study, which put so much fear into everybody. But again, like Melissa said, like we do prefer the transdermal. You can do that patches or creams.
Mhm.
I will say though, the vaginal estrogen stays in that region. It won't work systemically. So you won't get the benefits for bone health or Alzheimer's or cardiovascular health when you just do vaginal estrogen, but it does help that area. So I wouldn't worry about like if somebody more was like, fearing breast cancer, but was having a lot of UTIs. That I wouldn't fear taking vaginal estrogen because it stays in that area.
Mm,
But when we want to look at the whole picture and supporting the whole body, I will say like the patches and the creams that you put on your body are going to work more systemically and then it will protect you in other areas. Um, but yeah, I mean, there's multiple different routes, there's multiple different doses. Um, and there's different, like even compounding pharmacies, you can kind of compound it. So there's just so much back and forth with it. It's like
mhm.
not just take this patch. Like there is a lot of nuance in figuring out the right dose for you.
So interesting and so helpful. Um, okay, what's next? We're gonna talk
Next one is
testosterone.
testosterone.
It's so powerful.
Yes. And it's so funny because a lot of women don't realize like that they make testosterone. That
I
this it
know.
like we make I think it was we make more testosterone than estrogen, actually. It's crazy.
Stop. Okay.
So it is one that does need to be looked at. And um, testosterone supports our libido. That's probably what we know it most for.
Mhm.
But it also supports motivation, like getting things done, muscle strength, as well as bone density and cognitive drive. But testosterone has a narrow therapeutic window and it requires careful monitoring because we do have to be aware, and this has happened with some of my patients, testosterone can convert to estrogen. So if you're somebody that's estrogen dominant and you're like, well, I'm just taking testosterone, we do need to be aware you're going to convert some of that to estrogen. So that's going to feed into your estrogen dominant symptoms. But also, when you're very high, when you're in this high stress state, like this fight or flight, testosterone converts into a very like potent androgenic type of testosterone, which is called DHT. This can give you rage and anger. You want to like punch people.
Oh, shit.
So this has actually happened with one of my patients. So it's not
Your patient punched a person?
no, 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 no. She was
Oh.
feeling very ragey.
Uh-oh, I was like, "Shit."
Um, and it's like you get the testing, you have low testosterone. So you're like, well, hey, I need testosterone. Again, it's not the right environment. We haven't supported you prior. You can do way different things with that hormone. A messenger. You could make this into more a ragey testosterone. So there's a lot to think about. It's not just like take this and forget about it. Again, that back and forth. We need that feedback from you. And we can get a lot of this information by doing a great history, doing
Mhm.
the testing. We might know some of these things before giving you hormones, but there are some things that we don't know until we try them. And then it's like you need to be able to have a doctor that you can have back and forth with pretty regularly because things will need to change until you get everything settled.
Yeah, I mean, if a patient walks through my door and they're like, they're scoring high and like depression and anxiety, and they're like can't sit still and they're not sleeping through the night and they're like want to kill their husbands and like their life is they're sleeping 2 hours a day, like I'm not going to throw testosterone at them.
Yeah.
I'm not going to throw probably any of this at them until we get some of their life stuff in check and then calm down their adrenals. Like there's things that we would do beforehand. So if you're listening and you're like, this is the answer to all my sweet prayers.
I
It's
know.
like, if you're coming to us, we're going to start somewhere else, but we will get there,
Yeah.
but it just takes some time. Okay. So next we want to talk about why we don't love the pellets. And
Hmm.
if you know anything about estrogen, or I'm sorry, if you know anything about hormones, then you have heard that most of these doctors that I know in Michigan are doing pellets and they fucking
Yeah.
love them. And I don't
These
understand
clinics
why.
everywhere doing
They
pellets.
love it. And the problem is like you can't lower like once the pellet
Hmm.
is in, there's no
3
lowering the
months.
dose. 3 months? Okay, 3
Yeah.
months. There's no lowering the dose. It is there. You cannot stop it from happening, and you cannot respond to the side effects in real time.
Yeah.
So you're in it,
Yeah.
and your hormones are super dynamic, and the pellets are not. They are just releasing the dosage as and you may not need that, right?
Yeah.
So it's not flexible. That's why we don't like them. We
Yeah.
don't like it.
No. Yeah, and it's honestly the levels are so high because it's like a 3 to 6 month dose. The level that whole dose goes into you at that amount at one time. So that dose is insanely high. I have
Ugh.
tested some of my patients that have been on pellets, even at the towards the end of their pellet time, um, and their levels are insanely high. And it's like, okay, this is not normal. This is not how the body even works. Like we said, like your hormones are pulsed
Mhm.
daily. They're not it's not like this massive dose. Like what is your body supposed to do with that? It's insane. So, unfortunately, yes, once the pellet's in, it's in. You can't take it out. I mean, maybe I don't know, maybe somebody has taken it out, but like there's an incision and they push that thing deep in there. Um and it can be a little scary, but you get these very high doses, you get these really high spikes, and it's going to be unpredictable for everyone in how they metabolize that hormone. So, I mean, honestly, when you have a dose that high, this is definitely going to increase your risk for anxiety, for hair loss, for acne, mood changes, estrogen dominance, because like we said, you're going to convert some of that testosterone into estrogen. So you might have wildly high estrogen if you're having that high of amount of testosterone. And then obviously testosterone excess symptoms, which is yeah, a lot of like the acne and the
Mm.
oily skin and mood changes. It's just it I don't know. I'm not a fan if you can't tell.
No. No, and it's a poor match for the perimenopause
Yeah.
people. Perimenopause requires like frequent adjustments, like we're talking about, the small dose changes, the nervous system awareness, making
Yeah.
sure that you're not going to go punch somebody.
Yeah.
And like we said, the pellets are just a rigid thing. And in perimenopause, if you're listening, you're going through perimenopause, you know that every day is literally a brand new day. Like some days you feel like, man, life can't get any better. And then other days you're like, what in the hell is happening to me? There's no consistency, in my opinion, to perimenopause. So why I mean, giving you such a high dose sounds terrifying
Yeah,
to me.
and then if you're somebody that doesn't respond well, the practitioner might blame that on you,
Yeah.
where they'll be like, well, it's not the pellets. They work in everybody else that we put them in. And they might just say, well, you're just going to have to wait, like wait it out. But this is not okay. I mean, I'm not okay with this for my patients. Like, I don't like that's honestly seems scary for me. Like, I don't want you to go through that. Please
No.
don't. I want to
No,
protect you.
it's one thing because, like, I know, with functional medicine, it is not a quick fix, and we've preached that from day one, that it is something to be patient with and patient with yourself and patient with us. But when you are completely could potentially overdosing or just dosing too high for you for some of these hormones, it it is a disservice to you.
Yeah.
So, and as much as even if you were to come back to us and say, like, let's just say we're doing supplements or whatever, and you're like, "I am not well," we're gonna still change.
Yeah, 100%.
Of course, we want you to be patient and we need to be patient, sure. But if you're like, listen, I can't, my sleep is worse, we're going to examine it. And it may be something that you're taking, which is true, or it might be a lifestyle. We don't know. But with functional medicine, yes, we understand it's a long game. But with something like this, it's really, it needs to be tweaked as it goes along,
Yeah.
as you go along.
Yeah. And so, I mean, why we always go back to the adrenals and the stress response first, because this is the foundation to everything. If cortisol is dysregulated, your estrogen metabolism shifts to the more inflammatory. Your progesterone gets diverted, like I said, into making more cortisol. And your testosterone converts improperly to the more potent androgenic form of testosterone, and your receptors will downregulate. So, hormones cannot override your survival physiology. And this is why some women feel worse on hormones. It's not you, it's not the hormones. We have this terrain that we're working with. Symptoms fluctuate unpredictably, like crazily and wildly.
Mm.
And doses that should work don't work for some people because we must stabilize blood sugar first. Sleep has to be optimized. Stress response has to definitely be optimized. And your nervous system tone needs to be looked at first. And then hormones work with the body. They work beautifully because these messages are communicating how they're supposed to. And it's not like you're fighting yourself because everything's working better.
Such good advice. So let's talk about the long-term use and protective effects of the hormones. So
Yes.
when used correctly, hormones are associated with like you talked about, fractures, reduced fracture risk, cardiovascular protection. So when you have that like unexplained high blood pressure, let's look at hormones.
Very common in perimenopause.
Very common. Cognitive preservation. So I mean, it's hard because I got brain fog like crazy right now with perimenopause, and sometimes I'm like, "What's wrong with me?" Like, I've seen the memes where they're like, a woman is like, "I can't think of basic words." I'm like, "Yeah, I
Oh,
totally get that." So this these are some of the things that happen with perimenopause and how these hormones can help with that. And just your overall improved quality of life, like loving the people around you again, loving your husband, your partner again, um, those are going to improve your life. Not being so snappy with your friends and kids and all this stuff. These are things that could really help. And then reduce frailty with aging. Like I said earlier, like these women that aren't eating enough, this is going to affect their estrogen. And then this is going to affect their bone health. And then, so we want to make sure that we're aging so we can be in our 80s and lift up our grandkids and run across the room and pick up a coffee like, all these things are so important in your life. You need to be thinking about them now. How do
yeah.
I wanna age? How do I wanna live my 80s? And 90s to 100s, like, we're living long. Do you
Uh-huh.
wanna feel like shit for 30 years?
Mm-mm.
That sucks. So, looking at this key piece of your health would be very helpful to some. So it's not about like the anti-aging thing, although that is wonderful. But it is really about aging well.
Yeah, absolutely. I'm so glad you addressed that. But I mean, okay, so we'll talk about because there are risks that you want to think about,
Yeah.
benefits, and how to do this responsibly that Melissa and I keep honing in on because yes, there's so many clinics out there just giving blanket prescriptions and it makes me so sad. So there are some risks, but there are also risks to deficiency. So the difference is monitoring. You need someone that you can have that back and forth with that's going to monitor your dose. And it needs to be individualized. Like we said, like every single one of us is so different in our life, in our perimenopause stage, in our stress levels, like so many things. So we need to find someone that's going to help us with ongoing adjustments to that dosing when switching things up, switching even route of transfer, whether it's a cream or a patch or we have to have that functional medicine oversight. And honestly, It doesn't have to be only a functional medicine doctors. There are some educated other doctors out there that can be helpful, but hormones are not dangerous when they are respected, and they are dangerous when they're oversimplified. And I hope from this episode you guys understood that a lot of times it is so simplified. Like, oh, you have this symptom, take this. Like it it's not that simple, unfortunately, but they are amazing. They are so helpful. They're so protective. They do things that nothing else can do. They just have to be done the right way.
Yes, and I want to bring up a key point too about like the MDs, DOs, nurse practitioners that are that are doing this. You know, especially the MDs and DOs, when they're in medical school, they're not taught this. So anything they learn, because there's this I've seen on these Facebook groups where they're like, I would never go to a functional medicine practitioner who's a chiropractor. They don't know. I'm like, yeah, but these MDs learned it after they
Yeah.
did extra classes, or maybe not. So they never ever learned about
Which
perimenopause
a
or
ton of
menopause.
gynecologists, OBGYNs have they know absolutely nothing about
Nothing.
hormones. Yeah.
Nothing. And so to say like, well, I would only go to my MD for this type of treatment. It's like, well, then you need to make sure that your MD took all of the classes to understand how this works.
Yeah.
I just find it hilarious that like because we are chiropractors and functional medicine practitioners, we are not qualified enough, but we actually might have taken more
We're
classes and
overqualified.
understand it better than most of the MDs and DOs out there. So just be mindful of like trusting your doctors. Of course, I want you to trust your doctors, but like make sure that they have the backing to support this. It's not from their medical school training.
No.
It's just not.
Yeah.
So that's some key information if you're looking for a practitioner. So
Yeah.
in closing, we're gonna tie it all with a pretty little bow. Let's just wrap it up. Um, our bioidentical hormones, they're tools, but they're not shortcuts. That's what we've been trying to really fully express in this episode. When we prepare the nervous system, we support the adrenal health, we choose flexible delivery methods, and we monitor, adjust intentionally. Again, we monitor and adjust intentionally. That's very, very important. These are all ways that we can address this in a very healthy and satisfactory way. So hormones then become supportive. They're not scary.
Yeah.
And that's the difference between symptom chasing and just absolute true care.
Yeah.
So I hope that you guys took away a million different little words of wisdom from us because obviously Jen, this is what she does through and through. I would consider her an expert. She's my
Oh,
go-to for hormone health. She's taught me so much. So I hope if you have
thank you.
any questions, please reach out to us. We are always here to support in any way that we can. And
Yeah. I mean,
yeah,
I just say, I think you can hear our passion in this episode too, because it is such a very powerful therapy, but it has to be done the right way. And I learned this myself. I was so excited years ago when I went straight into bioidentical hormones for everyone. And I wasn't seeing the results that I was expecting with my patients. So we had to monitor and change. And I think that's what makes us better practitioners is because we learn from our experiences. We learn to be humble. Like, we don't know everything. We are continually learning. Like, there's so much to know, but to be rigid in one way of treatment and we don't listen to our patients, you guys are how we learn and how we get better. And so it's exciting and fun to support you and find the answers for you because everyone is different. So that's what we're here for. Like, you're helping us grow. So we appreciate you.
and by the time, honestly, a lot of the times, like by the time you get to us, you've already been to a bunch of doctors and you're highly educated on what
Yeah,
you have going on.
I
So you
love it.
come in with so much knowledge and so helpful because you know yourself and you know what you can or can't do or it doesn't feel good. And so you come in with that experience. We're like, okay, we can work with that.
Yeah.
So, ladies out there, I just want to give so much credit where credit's due of like figuring it out and working through these things. It's such a journey.
It is a journey. And you don't give up on yourself
Do
ever.
not
Yes.
ever. All right, everybody. Thank you so much for listening, and we will see you next time.
Take care.